So it's a pleasure to speak at this event and to start introducing the topic in terms of sunshine. So it's a bit, maybe a bit silly, this title, but I want to give you an impression why we think daylight is important. Certainly, there's more research needed, and along the slides you probably will recognize where certain gaps are. So we do live on an illuminated planet. I think that's obvious to everyone. And for millions of years, it was daylight, and we had dark nights. Occasionally, there was some moonlight, but basically, it was a clear distinction between bright days and dark nights. And this is one of the themes of these presentations here, that this distinction becomes a bit more blurry and distorted. So you see on this image on the right side the illuminated globe by artificial light, which is one of the things we are concerned about when nights become too bright. And why are we interested in light in the first place? Is because we have this biology, the circadian rhythm or the body clock or endogenous clock. So there are various terms. It's like an endogenous body calendar, as you wish, where everything that happens in your body is termed. So everything is pre-programmed genetically when to happen, when enzymes are produced, when proteins are produced, when you start sleeping, when you wake up, etc., etc. And this is a tight network which is synchronized to the progression of dawn and dusk. So we need bright days and ideally dark nights to keep this body clock, the circadian system, entrained, as we call it, so stably synchronized to the environment. So how does this entrainment look? This is a quick comic on this. So we have this idea that we have these synchronized rhythms. You see here melatonin and body temperature, which are the most studied parameters in this field, and the sleep-wake rhythm, and they are connected to each other. They are synchronized, and when your melatonin goes up during the sleep period, so the shadowed area is the sleep, and where you have the sun symbol here, this is the day. So usually melatonin goes up, has its peak during the night, and then it falls down again, and parallel to this, your body temperature drops and starts increasing. So about now, your body temperature is reaching the highest point later this afternoon. And when these rhythms become desynchronized, we do know that there are problems related to this. And this is a quick list on this. Basically, any pathology or health problem you can imagine is at some level, directly or indirectly related to sleep or circadian misalignment or disturbed circadian rhythms. So when we have not slept properly, we become a bit grumpy, and our mood suffers. And if this continues for many nights, then our metabolism suffers, and then the cardiovascular system suffers, and even things like cancer are on the table. So it's something we are very concerned about, and to understand how our environment, our lifestyle, light-dark exposure is related to this. It's not just a medical burden, it's also an economic burden, which has been estimated by people at the Rand Institute in England, here for Germany, for instance, or for the United Kingdom. Quite a big number of loss in productivity, so money that is lost due to sleep loss. So there's a strong incentive to better understand what's going on. And the big question is, what's the role of daylight in this? And this is one of the ideas why the Daylight Academy has been founded, to bring people together to better understand this. And one of the reasons, or one of the ideas, is one of the things that propels our research is the idea that we, as a collective, as a society, we are underexposed when it comes to daylight. So this is examples of 3 studies, one in the UK. In the middle, this is from various populations, a pooled analysis, and then we have data from the US. And they basically all speak the same language, that on average we have 1 or 2 hours of daylight exposure on average. On holidays, it's much more, on free days. We think that these numbers that we get on holidays should be on the regular days, because it would help our health to be better. So this is one of the findings that around the globe we see that humans spend more and more time indoors and too little time outdoors. This is an example here from a study in the US, and they had a very simple question: how does sleep and health differ between people who have a window at the workplace compared to those who don't have a window at the workplace? And it becomes very clear that those who have no window at the workplace, so no daylight at the workplace, have more physical problems and poorer sleep. And those with a window had more sleep, longer sleep. And we do think, of course, this is good. So there's a strong incentive to have workplaces with daylight, or at least if there are workplaces without windows, to guarantee that these workers have regular access to daylight, so that from time to time they go outdoors, or to have daylight in the break room, for instance. So one idea is to get more daylight into these people. Ideally, we would spend much more time outdoors. And this is an example here from a study that has been performed in the United States by the group of Kenneth Wright in Colorado. And he went to a camping trip with some people. And the strong evidence here is that they maximize the light exposure, of course. So you see here around 1,000 lux when they were in their office environment, and then they went camping for a week and they had 4 times this light exposure. And interestingly, they, after this week of camping, they looked at the melatonin, and they saw that the onset of melatonin is very close to the sunset. And when dawn, we had the downslope of the melatonin, and in the middle of this solar night, we had the peak. So after 1 week of increasing light exposure and decreasing light exposure in the evening, so more light during the day, less light in the evenings and in the night, a very, very strong synchronization process here, which beautifully shows how our circadian system is aligned to the light-dark cycle. Of course, we cannot all go for camping. So we had, a couple of years ago, we had this question at the University of Groningen, here led by our PhD student at the time, Giulia Zerbini, who now is at the University of Augsburg in Germany. We were interested in what happens if we manipulate light exposure at people's homes. And we had very, very simple protocols, simply asking people to not close the curtains in their bedrooms to get more daylight. And we asked them to do this for 14 days. And we saw that within 1 week, there was an advance in the melatonin, and this advance in melatonin correlated with the additional daylight in the morning. So again, good evidence that we can manipulate, or we can impact on our biology when we are getting more light into our rooms. And this is one of the discussion points at this meeting. What ways, what means, what strategies can we develop, or do we have to get more daylight into our rooms for the cases when we cannot go outdoors, which is most of the time for certain reasons. So the other side is that we know that light during the day synchronizes our body clocks. Light in the evenings and especially at night interferes with this process. And we have this term, what we call Zeitgeber strength. So bright days and dark nights represent a strong Zeitgeber. And if you play around with this, you see shifts in these circadian phases. So this is an example of getting more daylight into people, which shows an effect by simply not closing the curtains and getting more daylight onto your pillow. And then we asked the reverse question: what happens if we reduce light exposure in the evening? And we asked people to wear orange sunglasses for 2 weeks. Ideally, you want to change the lighting in the environment, which is a bit more extreme. But we simply asked to wear before they went to sleep for about 2 to 3 hours to wear these orange sunglasses. And also here we did see that within 1 week we could advance their melatonin by a bit more on average, a bit more than half an hour, and their sleep onset as well. So we didn't ask for anything else, just wearing these orange sunglasses to protect their eyes from blue light and light in general. So light intensity went down and the blue light exposure. So especially for those who struggle to find sleep, so instead of advising this to everyone, but for those people who are sensitive to light in the evening and those who have sleep difficulties, trouble falling to sleep, etc., this could be one way to help them seeking better and falling asleep better. And one of the ideas here is if you decrease light exposure in the evening and at night, you could prime the system and help your circadian system to get more out of the daylight. And in reverse, we know that if you have more daylight, so the more daylight you have, or the brighter in general, the brighter your days are, the more light your circadian system receives during the day. There's good evidence that this is at some level protective against artificial light in the evening. It's coined under the term light history. So the brighter the days, the more resistant your circadian system seems to be against artificial light. So there's good evidence in this. And you can play around with this and see how this impacts on your sleep. So this is especially, I think, relevant for those who have difficulties finding sleep. Another thing is the daylight savings time, which is basically a social convention. We don't save daylight, we don't save time or anything. We just change the clock, so it's a man-made thingy to change the clocks, and a social convention that for 7 months in a year we agree to go to work an hour earlier, and this leads to changes in the light exposure, and especially those who are late from their biology, late chronotypes who biologically sleep late and wake up late. These are the ones who are most concerned by this and suffer from this. So there's good research and accumulating research and very clear evidence. So there's no sign that the daylight savings time is good for health. There's no contradiction in this science. And we are working and helping and trying to convince politics to change these regulations. Ideally, it was introduced to save energy. That didn't work out. So there's a number of studies showing that this doesn't really work out. So that needs to be abolished. Another thing is that needs to be concerned or discussed more in detail when it comes to daylight, and it needs to be researched more, is shift work. So shift work exposes, so when people work shift, and especially when they work nights, they're exposed to light during the night. And we had this study here in Germany at the university hospital here in Bochum a couple of years ago, where we collected information in nurses, how much light they received. And I'd like to share this with you because I think there's some good ideas here how we can maybe introduce daylight also to help shift workers. We saw that during night shifts, or when these women were working nights, they had on average 4 hours more light across the day. So in total, their days become brighter. You could say they lost 4 hours of darkness in these days. So the question is, could a daylight intervention help being protective at some level in shift workers? From the social perspective, those women with children, younger children, had more light exposure in the afternoon because they went to the playground with these children. Similar, probably like walking a dog. So this could be, or it gives some good indication how our lifestyle interferes or manages or directs this light exposure. And there were differences between chronotypes. Late chronotypes had more light in the morning, evening, and intermediates more in the afternoon. So the big question is, of course, how daylight could help here. But shift work certainly is one of the things that strongly interfere with the circadian system. So to sum it up, it's overwhelmingly clear, and there's no contradiction, that health and well-being do rely on healthy sleep, undisturbed sleep, restorative sleep, in dark environments. And our sleep is tightly regulated and connected to our circadian system. So when the circadian system is not properly entrained, not properly synchronized, it easily happens that sleep gets compromised. So they are tightly working together. Ideally, if entrained, our circadian clocks help that sleep occurs at night. This is the usual case, and the circadian system works best in conditions of bright days and dark nights. So there's very clear evidence here. So for the future, and this is, it sounds simple as it stands here, but it's very complicated to get this into practice. One thing is to abolish daylight savings time. It should be promoted. So this idea should be promoted much more strongly, that we should get rid of this. We should more wisely decide where we apply shift work. The number of shift workers has increased in the last years globally. And it should be really, really a strong social discussion about where do we really need shift work, and where can we stop that. We do know the strong correlation between daylight exposure and health, and especially for those who have sleep difficulties or health problems, we should find ways to help these people to get more daylight. And the last point on this list is what we also will discuss here, and it's the transfer to the next speakers. How can we manipulate light in our environments? How can we make wiser lighting environments in our homes and workplaces, cost-effective, energy saving, and of course more using daylight? And this is what we hear in the next presentation. So thank you very much for your attention, and I'm very curious about the next discussions this afternoon.
Good. Thank you very much indeed, Thomas. We have time for, I think, any questions that are specifically related to your talk. The one from Timo Partanen asks, during which season did you do the Zerbini study with the curtains open? Because it might be that that had an impact on your findings.
Absolutely, it was in summer, and I should say it really depends, of course, where you live. So depending on how your summers are, we tried to repeat this in Germany in a small town, and it simply didn't work out because it was not possible to sleep with open curtains because of the weather conditions, because of the sun. So you have this compromise between the heating, if you have large windows and the heating up, and you need to find compromises here. So I see this as a proof of principle. Ideally, so principle, it works. It works if we increase light exposure and if we get more daylight into the rooms. So the decision now is how can we make this more thermo comfortable to these people. But we did this in summer.
I think because Timo's suggesting that it may not work in winter.
Yeah, of course. It depends when the sun starts rising. Of course, yeah, absolutely.
And I suppose it's about daylight saving as well.
Absolutely,
where you are with your dawn time. Yeah.
Absolutely, yeah.